Hey guys, okay, so this is going to be covering chapter 13, which is colon procedures and the male reproductive health. And I know it sounds like I'm a broken record, but again, make sure that you're reviewing the whole entire chapter, reading it completely, as well as all of the figures, the procedural steps, and case studies are very important on all the chapters, as well as the medical terminology review. Okay, so chapter 13, and we're going to start on page 504. So, introduction to colon procedures. Colon procedures are performed in the medical office or clinic and include the fecal occult blood test, or an FOBT, sigmoidoscopy, and sometimes colonoscopy, which are discussed in this chapter. The FOBT is a screening test used to detect in the stool for early detection of colorectal cancer. The patient must collect stool specimens at home. Some patients initially may be reluctant to comply with the FOBT patient preparation requirements and collection of stool specimens. The medical assistant can help by explaining the purpose of the test to the patient. If the patient understands the benefits to be derived from the test, he or she is more likely to participate as required. Medical assistants are often responsible for explaining to a patient the preparation required for a sigmoidoscopy and a colonoscopy. The medical assistant should make sure that the patient thoroughly understands the instructions. If the patient does not prepare properly, the procedure must be canceled, which requires the patient to go through the preparation procedure again. The medical assistant helps the provider during a sigmoidoscopy, and he or she should have a thorough knowledge of the responsibilities accompanying this procedure. All right, so structure of the large intestine. The medical assistant should be familiar with the structure of the large intestine. Highlight that the large intestine is divided into three parts, which include the cecum, colon, and rectum. The cecum is the first part of the large intestine. It consists of a blind pouch to which the appendix is attached. The cecum leads into the ascending colon and joins with the ileum, which is the last part of the small intestine. The colon makes up of most of the large intestine. It averages 60 inches in length and is divided into four sections, which include the ascending colon, the transverse colon, the descending colon, and the sigmoid colon. The sigmoid colon is identified by its S-shaped curve and connects the descending colon to the rectum. The rectum is located between the colon and the anus. The anus contains sphincter muscles and opens to the outside as a means of expelling waste from the body. Highlight that the primary functions of the large intestine include absorption of water and preparation of fecal material for elimination. Mucus is secreted from glands embedded in the intestinal wall, the mucosa of the large intestine. Highlight that the mucus binds the fecal material together and protects the wall of the large intestine from the irritating effects of substances moving through it. For blood in the stool, you need to highlight that blood in the stool can indicate a number of gastrointestinal conditions, including hemorrhoids, diverticulitis, polyps, colitis, upper gastrointestinal ulcers, and colorectal cancer. Some of these conditions, for example, hemorrhoids, produce visible red blood on the outside of the stool, making them easy to detect. Highlight that blood entering the stool in the amount of 50 milliliters or greater from conditions affecting the upper gastrointestinal tract, for example, peptic ulcers, causes the stool to exhibit melena, meaning it is black or tar-like. The dark color is a result of oxidation of the iron in the blood, heme, by intestinal and bacterial enzymes. If a minute quantity of blood is present, however, it is not possible to detect it with the unaided eye. Highlight that. Also highlight this hidden or non-invisible blood is termed occult blood, and its presence can be determined by testing the stool for blood. In the next paragraph, colorectal cancer is one of the most common forms of cancer in individuals older than the age of 50 years. During the early asymptomatic stages, almost all lesions, for example, benign and malignant tumors of the colon and rectum, bleed a small amount on an intermittent basis, and this is usually in the form of occult blood. Discovery of occult blood in the stool does not mean that the patient has colorectal cancer. It does, however, warrant further diagnostic procedures such as a colonoscopy to determine if colorectal cancer is present. Early diagnosis and treatment of colorectal cancer increases the patient's survival rate. In most cases, when more pronounced symptoms of colorectal cancer start to appear, example, visible bleeding from the rectum, a change in bowel habits, and abdominal pain, the cancer has reached an advanced stage. For the fecal occult blood test on the Couac slide test on page 505, above purpose, I want you to highlight that the patient must collect the 3 specimens at home and return the prepared slides to the medical office for developing. Under the purpose, the primary use of the Couac slide test is to screen for the presence of occult blood caused by colorectal cancer. Other conditions that can cause blood in the stool include the following: hemorrhoids, anal fissures, colorectal polyps, diverticulitis, peptic ulcers, ulcerative colitis, gastroesophageal reflux disease, also known as GERD, and Crohn's disease. Highlight that a positive test result on a Couac slide test indicates only the presence of blood in the stool. Also highlight that this means that additional diagnostic procedures must be performed, and also that they may include a colonoscopy. For the patient preparation, please highlight that the patient must follow a special diet beginning 3 days before the test and continue the diet until all 3 slides have been prepared. Highlight that the patient is placed on a high-fiber, meat-free diet. Meat contains animal blood, which could lead to a false positive test result. A high-fiber diet is used because it encourages bleeding from lesions that may bleed only occasionally. In addition, fiber adds bulk, which promotes bowel elimination and ensures adequate specimen collection. Highlight that certain medications irritate the gastrointestinal tract, which may result in a small amount of bleeding that could cause a false positive result on a Couac slide test. Medications that should be avoided include ibuprofen, for example, Motrin or Advil, naproxen, Aleve, and more than 1 adult aspirin per day. For the quality control, I just need you to highlight that the box must be stored at a room temperature between 59 degrees Fahrenheit and 86 degrees Fahrenheit. The contents of the box must be protected from heat, sunlight, and strong fluorescent light. On table 13.1, please highlight vegetables, medications, and special guidelines. On page 507, I need you to highlight where it says failure of expected control results to occur indicates an error and the test results are not considered valid. Possible causes include the use of outdated slides or developing solution, an error in technique, and subjection of the slides to heat, sunlight, strong fluorescent light, or volatile chemicals. Please review the highlight on colorectal cancer. We're going to go on over to page 509 for fecal immunochemical test. Highlight on the second paragraph where it says, although the FIT is more expensive than the Couac slide test, it is more sensitive to the presence of lower gastrointestinal GI bleeding than is the Couac test. Please become familiar with procedure 13.1 and procedure 13.2 on page 512. Please highlight number 3 procedural step. We're going to go on over to page 513 for a sigmoidoscopy. Highlight that a sigmoidoscopy is the visual examination of the mucosa of the rectum and the lower third of the colon using a flexible fiber-optic sigmoid scope. For the purpose, please highlight the conditions that can detect and assessing during a sigmoidoscopy include lesions, benign or malignant tumors, polyps, hemorrhoids, fissures, infections, and inflammation. On page 514 for patient preparation for a sigmoidoscopy, please highlight that the lower third of the colon must be flushed out completely so that it is empty and free of fecal material. This is known as a partial bowel prep because only a portion of the colon needs to be prepared. On a digital rectal examination, please highlight that using a well-lubricated glove index finger, the provider palpates the rectum for the presence of tenderness, hemorrhoids, polyps, and tumors. Also highlight that the digital examination also helps relax the sphincter muscles of the anus and prepares the patient for the insertion of the endoscope. For the sigmoid scope, the procedure, highlight that when the sigmoidoscopy is performed, the patient is placed on his or her left side in the Sims position. On table 13.2 on page 515, please review this, but I want you to highlight that the day before the procedure and continuing until your examination is complete, highlight do not consume any solid food or milk products, drink only clear liquids. The evening before the procedure, drink the following laxative, and the day of the procedure, highlight 2 hours before the examination, insert 1 Fleet's enema. 1 hour before the procedure, insert another Fleet's enema. I cannot stress that when it comes to explaining the patient the instructions for preparing for certain procedures, it is so very important that you explain to the procedure very carefully and thoroughly everything that the patient needs to follow. I cannot tell you how many times when I worked for a general surgeon, when we would do things like colonoscopies, if a patient did not prepare as they were instructed, that meant that the procedure was canceled, and that meant that the patient had to be rescheduled and had to do the preparation again. So it's very important that not only do you instruct the patient very carefully and thoroughly, but the patient follows those instructions, because otherwise it is a waste of time. And when it comes to the bowel preps that patients have to do, I can assure you that it is not fun. It is obtainable, but it's not exactly a over pleasant experience. Okay, so on page 515 under the figure 13.5, please highlight where it says a small amount of air is usually blown or insufflated into the colon through tubing attached to the air control valve located on the head of a sigmoid scope. On page 516, please review each of these bullet points. The medical assistant must prepare the patient for the procedure and assist the procedure during the sigmoidoscopy. These responsibilities include the following: determine whether the patient has prepared properly for the sigmoidoscopy. Ask the patient whether he or she needs to void before the procedure. Position and drape the patient in Sims position. Reassure the patient and help him or her to relax. Lubricate the provider's glove index finger for the digital examination, and lubricate the distal end of the sigmoid scope. Assist with suction equipment, and assist with the collection of a biopsy. Assist the patient after examination. Prepare the biopsy specimen for transport. Clean the examining room, and sanitize and disinfect the sigmoid scope. For colonoscopy, please highlight that a colonoscopy is a visual examination of the mucosa of the rectum and the entire length of the colon, sigmoid colon, descending colon, transverse colon, and ascending colon, using a flexible fiber optic colonoscope. On page 517 for patient preparation for colonoscopy, highlight that the rectum and the entire colon must be flushed out completely so that it is empty and free of fecal material. This is known as a full bowel prep. Please review Table 13.3 for a patient preparation for a colonoscopy. And we're going to continue on page 518 for Introduction to Male Reproductive Health, Prostate Cancer. Please highlight that the prostate gland surrounds the urethra and is located just below the bladder and in front of the rectum. Highlight that it is approximately the size and shape of a walnut, and its function is to secrete fluid that transports sperm. In the early stages, prostate cancer often causes no symptoms. Symptoms that occur when the cancer is more developed include the following. Please highlight that it's difficulty in urinating, weak or interrupted urinary flow, pain or burning during urination, frequent urination, especially at night, blood in the urine, pain in the lower back, pelvis, or upper thighs. For a prostate cancer screening, under the digital rectal examination, also known as a DRE, please highlight that normally the prostate gland should feel soft, whereas malignant tissue is firm and hard. For a prostate-specific antigen test, also known as a PSA, it's a screening test that measures the amount of PSA in the blood. PSA is a protein normally produced by the cells of the membrane that covers the prostate gland. Highlight that the normal range for PSA is 0 to 4 of mg/ml of blood. ml. Also highlight that the higher the PSA level, the more likely that cancer is present. Other conditions other than prostate cancer that can cause an elevated PSA level include benign prostatic hyperplasia and prostatitis. Highlight that the PSA level may normally increase after vigorous exercise such as jogging or biking. Later in the paragraph, highlight that to make this assessment, one or more of the following tests may be performed. Transrectal ultrasound, a TRUS, a biopsy of the prostate gland, bone scan, and a computed tomography scan, also known as a CT scan. On 519 for the testicular self-examination, highlight that although testicular cancer can develop at any age, it is most common in males 15 to 34 years old. Highlight that certain risk factors increase a man's chance of getting testicular cancer, including the following: a history of cryptorchidism and undescended testicles, I can't talk, I'm sorry guys, a family history of testicular cancer, cancer of the other testicle, and Caucasian race. Highlight that a TSE should be performed monthly starting at 15 years of age. The best time to perform the examination is after taking a warm bath or shower. Highlight that the most common sign of testicular cancer is a small, hard, painless lump about the size of a pea located on the front or the side of the testicle. Please review the testicular self-examination, the terminology review, also review the case studies and the figures, the tables, and the procedures in this chapter.